the general framework of a TICN is to get a network of community members, of providers, and here in Greater Williamsburg, we have professionals that represent our systems of care, that represent our child serving systems, and they work together to educate about the impact of trauma. We talk a lot about the science behind trauma, the adverse childhood experiences, or ACEs, that the more you experience those growing up, the more likely you are to have negative health outcomes, because trauma physically impacts your body, and a lot of people don't necessarily know that. And so when you have experienced trauma, and when it's gotten to the point where it's maybe changed your behavior or changed your response to a threat or a perceived threat, it can make it harder to navigate. And so when we decided as a Greater Williamsburg community to start our own network, we brought together those systems of care. So we brought together the public serving agencies to say, as a system, we need to recognize that trauma exists, and trauma has impacted the majority, if not all, of the individuals that we're serving in some way. And as systems, we need to not perpetuate that trauma. So when somebody walks in our door looking for services, we need to not make it worse, for lack of a better term. And so what we did as a network is we got, folks who are my counterparts in the systems, and we started the conversation about, what does trauma mean to you? What does trauma look like to you? What does it look like in the families and the individuals you're serving? But also, what does it look like in the folks who are doing the work? Because we learned very quickly, that secondary and vicarious trauma is very real. And so if you're not healthy yourself as an individual trying to serve somebody, you're not going to be as effective. One of the metaphors is you can't pour from an empty cup. So I think as a network, supporting each other has been really crucial. Talking to other people about what they're experiencing, and we work within our schools. We work within our human service agencies. We're working with our healthcare providers. COVID has been difficult and challenging for everybody, and that's a common trauma that people have experienced. So I think we're trying now to just make people aware of trauma can show up in many different ways, but the body doesn't know what the trauma is. The body just knows it's experienced trauma. And so it's trying to start the conversation in our community about what that looks like and how we can work to counteract that. And relationships is a big part of what can build resilience to counteract that trauma.